Hi everyone, welcome back to my YouTube channel. Hope you all are doing well. Today's video is about Medicare Advantage, risk adjustment, data validation, final rule fact sheet. Let's get started. In a final rule released on January 30th of 2023, the Centers for Medicare and Medicaid Services or CMS finalized technical details regarding the Medicare Advantage or MA risk adjustment data validation or RADV program that CMS uses to recover improper risk adjustment payments made to Medicare Advantage or MA plans. The RADV or Risk Adjustment Data Validation Final Rule will help CMS to protect the MA program, also known as Medicare Part C, by addressing instances where Medicare paid Medicare Advantage organizations or MAOs more than they otherwise should have received because the medical diagnoses submitted for risk adjustment payment were not supported in the beneficiary's medical record. Specifically, this final rule codifies in regulation that as part of the RADV audit methodology, CMS will extrapolate RADV audit findings beginning with payment year 2018. Medicare Advantage payment and the role of risk adjustment data validation audits. CMS contracts with private companies called Medicare Advantage organizations or MAOs to offer various health plan options for Medicare beneficiaries. These MAOs provide all Medicare Part A and Part B benefits, also known as traditional Medicare or Medicare fee-for-service or FFS, and most offer additional benefits such as Medicare drug coverage beyond those covered under the Medicare fee-for-service program. Nearly 30 million individuals receive their Medicare benefits through Medicare Advantage. CMS has a statutory obligation and fiduciary duty to ensure payments in the Medicare program are accurate, including conducting oversight of payments made to Medicare Advantage organizations or MAOs. This approach is well established among other CMS programs and ensures consistency in CMS's oversight of the Medicare fee-for-service and Medicare Advantage programs. Section 1853A1C of the Social Security Act or the Act requires CMS to risk adjust payments made to Medicare Advantage organizations. CMS pays each MAO or Medicare Advantage organization a monthly amount for each beneficiary enrolled in a Medicare Advantage plan, which is adjusted to account for differences in health status amongst enrolled beneficiaries. This adjustment is referred to as risk adjustment. Risk adjusted payments are based on medical diagnoses submitted by the MAOs that, by long-standing regulations, must be supported in the Medicare enrollees' medical records to ensure accurate payment. Risk adjustment strengthens the Medicare Advantage program by ensuring that accurate payments are made to MAOs based on the health status and demographic characteristics of their enrolled beneficiaries, and that MAOs are paid appropriately for their plan enrollees, that is, less for healthier enrollees who are expected to incur lower healthcare costs and more for less healthy enrollees who are expected to incur higher healthcare costs. Making accurate payments to MAOs is part of CMS's responsibility to ensure accurate payments across the Medicare program and ensures continued access to benefits and services for people with Medicare while safeguarding federal taxpayer dollars. Studies and audits done separately by CMS and the HHS Office of Inspector General or OIG have shown that medical records do not always support the diagnoses reported by MAOs, which leads to billions of dollars in overpayments and increased costs to the Medicare program. RADV audits are the main corrective action for those improper payments. Through RADV audits, a sample of beneficiary medical records are provided by MAOs and CMS reviews those records to verify that diagnoses reported for risk-adjusted payments are accurate and supported in the medical record. Risk adjustment discrepancies can be aggregated to determine an overall level of payment error, which can then be extrapolated. The HHS OIG also undertakes audits of MAOs similar to RADV audits as part of its oversight functions. CMS can collect the improper payments identified during those HHS OIG audits, including the extrapolated amounts calculated by the HHS OIG. Final rule policies, extrapolation. Rather than applying extrapolation beginning for payment year 2011 audits as CMS proposed, they are finalizing a policy not to extrapolate RADV audit findings for payment years 2011 to 2017 and beginning extrapolation with the payment year 2018 RADV audit. As a result, CMS will only collect the non-extrapolated overpayments identified in the CMS RADV audits and OIG audits between payment year 2011 and payment year 2017. CMS is not adopting any specific sampling or extrapolation audit methodology but will rely on any statistically valid method for sampling and extrapolation that is determined to be well suited to a particular audit. However, any extrapolation methodology adopted by CMS for RADV audits will be focused on MAO contracts that, through statistical modeling and/or data analytics, are identified as being at the highest risk for improper payments. While not required, CMS will continue to disclose their extrapolation methodology to MAOs, providing MAOs with the information sufficient to understand the means by which CMS extrapolated the RADV payment error. Extrapolation has historically been a normal part of auditing practice at CMS, including in fee-for-service Medicare, and CMS interprets their existing authority as authorizing the use of sampling and extrapolation in RADV audits. It is also expected that the use of extrapolation will incentivize MAOs to take meaningful steps to reduce improper risk-adjusted payments in the future. FFS adjuster. The rule also finalizes the policy as proposed that CMS will not apply an adjustment factor known as an FFS adjuster in RADV audits. As described in the final rule, the requirement for actuarial equivalence in Medicare Advantage payment applies to how CMS risk adjusts the payments it makes to Medicare Advantage organizations or MAOs and not to the obligation to return overpayments for unsupported diagnosis codes, including overpayments identified during a RADV audit. In addition, CMS does not believe that it is reasonable to read the Act as requiring a reduction in payments to MAOs by a statutorily set minimum adjustment in the coding pattern adjustment, while at the same time prohibiting CMS from paying at those reduced rates by mandating a FFS adjuster for RADV audits. The RADV final rule can be accessed at the Federal Register at the URL which you can see on this slide. I have also pasted this URL in the description box down below. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.